I'm Roger, and we are going to do the assessment of the adult musculoskeletal system and neurological system. And this is our patient, John Doe. Starting out, have you had any problems with muscle cramping or swelling?
No cramping or swelling.
Have you had any injuries to muscles?
No, no injuries.
Have you had any aching or pain?
No, not really.
Any stiffness
No, no muscle stiffness.
or difficulty moving? Any extremities?
No, not at all.
Have you had any unexplained increase or decrease in strength to the upper or lower extremities?
No.
To one side or the other? What would you say your activity level is?
Moderate. I walk probably a couple miles a day.
Have you had any speaking of your bones and joints, have you had any stiffness or joint swelling? Any
No.
redness or injuries?
No, no redness, no injuries.
No deformities?
No.
No unexplained aching or pain?
No.
Have you had anything that gets in the way of you doing your activities of daily living?
No, not at all.
Any limitations in movement?
A little bit in my right shoulder.
Have you had do you have arthritis? Has your doctor ever talked to you about having arthritis?
No.
Okay. Well, we're going to have you take a few steps for us towards the door so we can check out your gait or how you walk.
Okay.
Okay. And the patient was able to walk in a straight line with a normal gait. Posture is proper. Head, shoulders, and hips aligned. If he turns to the side, face your side towards us. You see he does not have any kyphosis, lordosis, and if he turns his back towards us, he has a straight spine showing no scoliosis or deformities. Okay. So now going through all the different, starting from the head and going down to all the different joints. So you're able to move you can face towards us again. You're able to move your head from side to side, up and down, then around in a circle. Is there any pain while doing any of that?
Not at all.
You're able to lift your shoulders up, shrug your shoulders up,
Okay.
and make a full circle. Okay. Are you able to open and close your mouth? Move your jaws to the left to the right, and stick out your chin and retract your chin. Is this causing any pain?
No.
Able to clench your teeth? Okay. So we're gonna check out his back here. Is there any pain anywhere in your going down your spinal column here?
No.
Okay. Spine appears to be in a straight line and symmetrical. Shoulders were also symmetrical. Okay, now we're going to have you lift your arms out and down. Was there any pain in that shoulder while doing that?
It pops.
Okay. And was there an injury associated with it?
A long time ago.
And it doesn't get in the way of any of your daily activities?
No. I can exercise with weights.
Okay. Now lift your arms in front of you. Now stick your arms out and rotate them in and out. Okay. And Now we look at your elbows. No pain in your elbows on either side?
No.
Okay. And you're able to bend them all the way in? A little way out. Okay. Now in your wrist, do you have still able to move them up and down,
Sure.
in and out, in a circle? Is there any popping,
No.
clicking? Still have all 10 digits, so you're able to move your hands in a fist, extend them all the way open, close them all the way, and spread them all the way open. Okay, now we're going to inspect your hips. Are you able to move your knee, lift one knee up, now the other side, without pain in your hips. And then,
That's good.
okay, and you're able to lift the leg out laterally on both sides. You're able to extend, watch out, there's a chair behind you, but extend your leg back. Any knee problems? Any pain in your knees?
No pain in the knees.
Okay. You still have all 10 toes. Any problems with your feet, arches?
They're good.
Okay. No abnormalities of the feet noted. What are your ankles? Are you able to rotate them in a circle? No, just your ankle. On both sides. Okay. Alright, now we're going to assess your neurological system. Any chronic diseases such as brain infection, diabetes, thyroids, or hypertension?
None of those.
Any histories of seizures or convulsions?
Never.
Any spells of vertigo or dizziness?
No.
Any sudden or onset of weakness or numbness or paralysis?
No.
Any problems with your balance or coordination?
No.
Any difficulty swallowing?
No.
Any changes in vision?
No.
Any changes in being able to feel things?
No.
Any decrease in facial function?
No.
Any noted reduce in hearing?
No.
Any speech problems such as stuttering, not being able to come up with the words that you need, or
No.
describing a situation?
I speak fine.
You're able to shrug your shoulders still? Okay. And turn your head from side to side. Be able to stick your tongue out, go straight. You puff your cheeks out. Okay, so now we assess the cranial nerve. The first cranial nerve is for smell. The patient says they are still able to smell.
Correct.
Differentiate smells.
Yes.
Okay. Any changes, cranial nerve number 2, any changes in visual fields?
No.
Any changes in not being able to see peripheral as well? Are you able to see my finger here
Yes.
and here?
Yes.
Okay. Cover one eye and just test blank. Okay. We inspected his eyes, his pupils to see that they're round. They're accommodating and they are neither of them are deviated. Inspected the eyelids. There's no drooping in his eyelids. And those cover cranial nerves number 3, 4, and 6. Cranial nerve number 5. We're going to have him chew. And then you're also, so it's also a sensation. Are you able to feel inside of your mouth
Yes.
and on the outside?
Yes.
Okay. So we're going to inspect for cranial nerve number 7. His nasolabial folds are equal, no drooping, able to raise both eyebrows, and able to squeeze eyes shut, wrinkle forehead, able to smile, frown, smile showing teeth, and purse lips, and blow out. With the, like, puff out your cheeks. Okay? And say B, M, and P.
B, M, and P.
Okay? Any changes in cranial nerve number 8? So any changes in hearing?
No, I hear fine.
Cranial nerve number 9. So it's gag. So open your mouth and try to swallow for me. And we're able to see the uvula is straight. Have you had any problems with gagging or swallowing, or have any have or not when you swallow something, if it goes down the wrong pipe, you're able to cough and.
I do cough if that happens.
Now push your tongue against your cheek on either side. On this side, okay. Okay, so now you can sit down. We're going to have you pat your hands against your knees on your both sides. So start slow and then a little bit faster and faster. Okay. Now we're going to have you touch your nose and then touch your finger with this hand. Touch your nose on your finger. Same thing again. Again. Okay, now with the opposite hand. Okay. So now we're going to have you close your eyes and hold both hands out, palms up. Okay. And now we're going to have you put your heel to your shin and go up to your knee and back down. Okay, now with the other side. Okay. So now we're going to have you to stand with your feet together, your eyes closed. Now if I push you a little bit. Okay. Now stand on one foot. Now on the other foot. Now hop in place, both feet. Okay. Walk heel to toe, just this way. Now come back walking on your toes. Okay. Hey, are you having any pain in your face, or your hands or arms?
No.
In your chest, abdomen, feet, or legs?
No.
Okay. Now, tell me if you're able to feel. Does one of these, do you feel more one than the other?
Same. 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 Same.
Okay. We do not have the proper tools to check reflexes, and so that concludes our assessment.